stuff like that. So,
Great.
all right, Dr. Solt, it's really a pleasure to have you. How have you been since we talked last?
Yes. Well, thank you so much for having me back. I think the last time we talked was end of June. So about 4 months ago. Everything's been awesome. I've been, busy obviously in my practice and still just doing amazing stuff in the carnivore world. It's been so exciting to really just continue to dive into this and work with more patients that are carnivore based. It's been super cool.
So for people who don't know you, and I'm just to think you're just a rock star in helping people heal from so many things. Tell us a little bit about your naturopathic training and how it sort of drove you into the carnivore world and the other things you're doing.
Yeah. So, like you said, I'm a naturopathic doctor by training. I'm located in Scottsdale, Arizona, and my practice really concentrates on regenerative and anti-aging medicine. So, utilizing therapies such as stem cells, PRP, which is platelet-rich plasma, hormone replacement therapies, nutritional IVs, targeted supplements, usually short-term duration stuff. It's really just help people heal in a meaningful way and give them answers that the traditional medical model really hasn't. And my training, of course, like I said, is as a naturopathic doctor. So when I made my way into the carnivore world, there was a lot of unlearning that had to happen as far as plants go, because it's very cool to be super into plants as an ND. There's a lot of people in the plant-based movement that are NDs, a lot of people that push a lot of veganism, vegetarianism. So I'm kind of an outlier in my field. There are a few of us, I will tell you, there are a few of us that are making their way to this side, but I'm kind of an outlier for the most part.
And it's growing, isn't it?
Yes, thankfully. I feel, I have a decent audience of other naturopaths on my social media, and you wouldn't believe some of the messages that I get with people that are actually making the transition, trying it out, and really seeing that, okay, maybe there is a better way. Maybe we didn't learn everything in our medical education that we should have, and maybe there was some stuff that was incorrect, right? I mean, it's safe to assume that not everything that we were taught is always correct all of the time. I mean, they used to teach bloodletting in medical schools, right? I think that as new research comes out, we really do need to re-educate.
So what got you into naturopathic medicine in the first place?
So short version is that it really made sense. I was I was basically doing some degree of pre-med when I was in college. My undergraduate degree is actually in kinesiology and health promotion. So I did a lot of physical performance stuff, athletic stuff. And then we had a presentation one day on what it means to do naturopathic medicine. And the way that they explained it, it was, well, we actually get to the root cause of disease and heal it that way instead of just managing symptoms. And I said, well, that makes complete sense. So that's kind of how I made that determination versus going to regular medical school. And the biggest distinction there is that you still have to become a doctor. So you still have to learn all of the doctor stuff, all the diagnostics, all of the conventional treatments. So we still have to understand, okay, what is the conventional treatment for this type of disease process? What are the pharmaceuticals that are usually given or the surgeries that are usually done? Still have to learn all of pharmacology, because in many states we are full licensed providers and have prescriptive rights up to Schedule II substances. So we learn all the basic medical stuff, and then we learn the alternative stuff on top of that too. So many of us learn acupuncture, we learn nutrition to a really deep degree. Again, not always correct though. And of course we learn botanical medicine, and there's just, again, all the alternative things. And that's our clinical training versus say going into neurosurgery or learning gastroenterology or whatnot.
Do naturopaths, is there a track to go into any of those areas, or is that sort of the DOMD directive?
It is, simply because not every single state has the same sort of scope of practice for naturopathic doctors. Some states we can do certain things like minor surgeries and whatnot, but not every state is fully licensed. There are some states where it's actually even, we'll say, illegal to practice naturopathic medicine, which I think is completely insane.
Yeah, but we find a lot of stuff insane in this country, in this world, for sure. So as you were learning and going through your naturopathic training, did you see yourself in the carnivore space back when, or was it sort of just not even there yet?
It's so funny. That's such a thoughtful question, because I grew up with meat. Like that was, I mean, I come from a very Italian background. My dad actually goes hunting every year, gets fresh deer, fresh moose. And like, that's what we would grow up on. And he would also hunt rabbits. He would go turkey hunting. Like we always were very, very meat based, made his own salami, homemade,
Wow.
like it was very, very meat based growing up. And funny story. So in high school, we actually had a project for one of like our social studies classes. And it was basically find an injustice and do a presentation on it. So the injustice that I picked was cruelty to animals. And I wanted to prove that you could eat according to the Canadian food pyramid, I'm Canadian, and still be healthy, right? So take out the animal products, no cruelty to animals, and eat according to this, because that's the government guidelines. And I only did it for a week. I gained weight. I couldn't stay awake in class. I got acne. All of these things happened. And initially my thought was, wow, we can't trust the government at all. So that's still proven to be true long-term, right? But then the other aspect that I look back on it now was, wow, replacing all of the animal products, and even the Canadian Food Guide still recommends a very, very small amount of animal products each day. But even just removing that small amount and replacing them with plant things completely wrecked me for only a week. And so that was a really big like turning point for me in that regard. And I've never cut out meat from my diet since then. So this was kind of a natural transition too.
So do you think that, and I imagine way back when, as I was basically a Mediterranean, I'm Italian descent, and never really was taught anything about real nutrition, but I don't think any of us really understand it mostly today. But are we espousing plant diet because we just don't really see the other side at all? It's just we're all blind to it, and we believe that plants are the solution? Or do you think there's some sort of, maybe we're ignoring it for some other reason?
It's really hard to say. A lot of the education around what we're supposed to eat, I think, is coming from organizations or people in power that honestly have no right to tell us, right? Like it's not people who understand nutrition to any deep degree. It's not people who even understand how to even structure nutrition in a way that's going to be helpful to the earth, right? We have a lot of monocropping going on, which is damaging our soils. We have the ability to do things like regenerative agriculture, which could actually even build back our soils and be a much more sustainable way for people to eat in general. So there's a lot to unpack there.
Which we don't really sort of, it's a lot of commentary, but I don't know how critical and important it really is. But the benefits from carnivore, and were you in the keto space really, or did you go sort of carnivore?
I was actually never a fan of keto, and I'll tell you why. When keto became a really big craze, I was kind of like trying to get pregnant. We were talking about getting pregnant, and what I was seeing clinically in my patients was I was getting a lot of middle-aged women coming in who had done about 3 months of keto and completely wrecked their hormones. They did great for about 3 months, and then there was this plateau, and then there was this rapid weight gain, this loss of hair, their thyroid went underperforming, just everything kind of tanked. And I was like, wow, maybe keto isn't all that great. And so I never personally dove into that because, again, just what I was seeing in my patients. And again, I do have to caveat that all doctors have a doctor bias, right? We see what walks into our clinic. We don't see the healthy people that are doing it well. You know what I'm saying? Like they have no reason to come see me. But again, the things that I were seeing was pathology as a result of keto. So for me, I was like, okay, this doesn't seem that excellent for a large portion of the population. I was doing fine, just doing what I was doing. And I really do think that carnivore is a better answer for a lot of people, not everybody, than keto, because most of us are so severely under-proteined. We just aren't eating an adequate amount of protein for all the healing and repairing that has to happen in our bodies, especially if we're coming from a strong history of being in the standard American diet and consuming plants. The need for repair in our bodies becomes so high, it has such a metabolic cost that depleting the body for its adequate protein requirements in order to meet the keto satisfaction of the high fat intake, I think is doing a lot of people a disservice. And I think that's why a lot of women ended up with low thyroid function hormones being tanked, cortisol going elevated.
And what is what is the things that you're mostly seeing in your practice that you're focusing on today?
I do a lot of chronic pain and sexual dysfunction in my practice. And it's so interesting. Last time we spoke, I think that I was in the process of developing my program, my stem cell
Mhm.
program. And that launched at the end of July. And what the feedback has been from that program, and again, this is basically what they do before they actually come to see me for their treatment. And I'm teaching a lot of diet stuff in there. I have a whole module on way of eating, and it breaks down a lot of unlearning first. We go through all the unlearning first, and then we reteach what it means to actually eat a healthy diet that's going to be in line with our goals, which is reduce inflammation and provide the body the nourishment that it needs to actually go through the healing that we're going to be signaling it to do. And on average, by the time my patients actually get to me, they have about a 30% reduction in their pain, which is insane. Like most people, some people it's 20%, some people it's been as high as 50%. Some people are like, oh yeah, that area of my body is just completely fine at this point. Like this is powerful stuff, It's been super cool.
So is that plan, and where do people go to get into that plan?
Yeah. So my website is just stemcelltherapypro.com. If you type my name into Google, it should be the first one that comes up. And we take patients on kind of an application basis. So there's a form that you can fill out to schedule a call with me to see if working together is going to be a good fit. Because it matters to me to make sure that my patient is going to be a good candidate for what we're doing. So it's really hard to provide healing in patients who won't adopt some degree of an animal-based diet, just because we're not going to be able to get you the right nutrients in the right amounts for what we're telling the body to do. And of course, we want to make sure that we're taking candidates that are non-smokers, that aren't taking certain medications. And there's just kind of a list of criteria that you have to meet.
And how many of those patients are open to carnivore or
Pretty
some
much.
form of?
Yeah, all of them. All of them have been doing it, and it's been really cool. I had a patient. We just did her 1 month follow up at the end of last week, and just in the 1 month from doing again the diet changes, the stem cell therapy, everything that we've done, she no longer has any spider veins. That wasn't even something that was part of our treatment. Like that wasn't even a target. Like they just went away completely, and she was so thrilled with that. And of course, the chronic stuff that we were working on also improved, but just a month. Like it's so fast, and it's just so meaningful for these patients.
So of those patients that are coming to you, are you finding, because I know you focus on stem cell therapy and PRP therapy, are you finding that even many of them may not need some of that treatment once they've done the nutritional changes?
Yeah, some stuff just goes away. Like some of their main concerns, because we meet with them initially. They tell us kind of all the things that are going on. We kind of map out like, okay, this is likely what our approach is going to be. Sometimes it changes when they actually get in my office and we can do a physical exam and really assess things. But then after that initial conversation, that's when they get put into the program. And the program takes them about 2.5 weeks to go through. And then it's about another week after that where we let them integrate some stuff for a little bit longer before they talk to me again. During that call, we reassess to see what things did change. And if there's areas that just simply got better, we're like, cool, we no longer have to treat that. But I mean,
Wow.
even things like 20 and 30% reductions in pain levels, like that's someone going from, a 7 out of 10 to maybe a 3 out of 10. It's really significant.
And tell us a little bit about supplements and what are your current recommendations? And I hear you have something new also going on. Maybe you could share that with our community.
Oh my gosh. So supplement wise for my patients, there's a few things we send them what I call my success kit. And it's basically a kit of supplements that I think most people will benefit from going into this program because we simply usually have a lot of repletion to do. One of the things being a mineral supplement, some electrolytes. We also give them a collagen powder and some magnesium. And these are all things that, again, work with what we're trying to do with people. But what you're talking about is our newest supplement, and I got it right here. It's our supplement. It's called Oyster Boom, and it is a pure oyster powder. And I'm obsessed with oysters. I've been eating oysters for years. It's something that I share on my social media every week when we get them. And there's nothing And people would comment all the time on our pictures, like, oh, I wish I could have oysters. Like, they're not anywhere near me. I don't like the taste. And there's so many benefits to them. Like, I really do think that oysters are the most underrated superfood. And I think that, again, a lot of the time it's cost prohibitive for people, because you go to a restaurant, and depending on the restaurant you're going to, you're paying anywhere from $2 to $3 per oyster.
Right.
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 So it can be cost prohibitive for people. But as far as bioavailability of the essential minerals that we need, in addition to other trace minerals, oysters are it. Like, that is probably the best source that we can get in the world. So when I'm seeing these comments, I'm like, I need a solution for these people. And I started looking up, like, is there an oyster supplement out there? And the ones that I found were basically on Amazon, and we all know Amazon is like the worst place for supplements because they're gimmicky at best. And there was ones that were just a lot of fillers in them. They wouldn't cite their sourcing. They wouldn't cite if they were tested for things like heavy metals. And even the supplement dispensary company that I use called Full Script, they had nothing on there that was even close. Like, there was just nothing. So I'm like, well, there's a need here. Like, there's a gap in the market for something like this that's going to be high quality. So I'm like, let's see what we can do. So contacted this company that I found that's actually located in Ireland and owned by a marine biologist who is just as obsessed with oysters as I am, possibly even more. And we just kind of dove into, like, well, what do you have going on? What is your company doing? Well, they batch test for heavy metals on every batch that comes through. They do wild caught sourcing whenever possible. And this current batch is a 100% wild caught batch. They test for other impurities. They make sure that pretty much no shell fragments get in there at all. It is just the pure oyster. There's about 7 large oysters per serving in our bottle, and each serving is about $2. So it ends up being way more cost effective than if you were to actually eat the oysters. And there's about 12 pounds of fresh oysters per bottle. I felt so good about this. My husband and I, we both actually took them for about 2 months before we decided that we were going to, like, fully go forward with this. So I've been, like, thinking about this for a long time. It's taken us a while to get here, and I am a terrible person at keeping secrets. So the fact that I, like, held this in was a really big deal for me. But we're so thrilled right now. Like, we're so thrilled to get this into the hands of people, to get their mineral status back up, because that is something that I see clinically over and over again, just from people being so deficient in a standard American diet, and then also exacerbating those deficiencies by eating plants, because most of the anti-nutrients in plants are mineral blockers. So this is my answer.
So I was excited because I was driving home from work the other day, and there you guys are, Zach and Sabrina, and then you're talking about the oyster supplement. I'm like, well, number one, I love oysters. But one of the problems, I think, when people eat oysters, they put all this other stuff on them and I know even a little hot sauce on them, which probably will reduce the amount of nutrients that you're gaining anyway. And so I don't know. This is, to me, was like, I hadn't heard of this before. And I'm like, okay, this is fantastic.
Yeah, we're excited. And just like you said, like, there isn't anything like this. It's really, and especially, like, it's just there isn't. I cannot believe it. I mean, I sort of can, though, too. I mean, we just really kind of turned the corner on things like desiccated organ supplements and things like that. But as far as oysters go, we're so excited to just bring this. And I really hope that it gets, widely adopted, especially in these communities, because it's a super useful thing to have to get those minerals in.
Well, what's the brand that what's your name? What's your
So
label?
our company that Zach and I own together is called Harder, Happier, Healthier, and it's actually like a sister company to my clinical practice. Really, mainly actually focused on sexual dysfunction and sexual health, specifically for men's health. But so our Oyster Boom supplement is underneath that company. But yeah, if you head to our website, it's just harderhappierhealthier.com. That's where this supplement lives. And if you use the code SOLT, it'll get you a little discount on that as well. And it is free shipping throughout the US. We have not figured out international shipping yet. We're kind of learning this as we go. We are literally mom and pop doing this thing right now. So you're supporting our family if you decide to make a purchase. So yeah, check it out for sure.
How many children do you have now?
We have 2 children. Our daughter will be 5 in January and our son will be 2 in December. So
Wow. How amazing. You guys are amazing. Well, we're going to put a link for that because I really think it's fantastic. Tell us a little bit about male sexual dysfunction. What are the signs and symptoms? What are people having problems with, and the causes, and how do we approach it? Because I think we just don't talk about it in our Western fertility world quite as much as we should.
Yes, I really do think that erectile dysfunction and men's sexual health in general is something that is being entirely overlooked, and it's really a silent epidemic that's been going on. And originally, I started seeing this in my practice because, again, I was treating a lot of middle-aged women who were coming to see me for their hormone issues. We build up rapport over a few months, and all of a sudden it's, I need to get my husband to come in to see you. Well, the husband would come in, and we would start talking, and we would talk about their concerns. And I'd say about 50% of the time, they would actually tell me that there was some degree of erectile dysfunction. And most of the time it's, well, I think I need a little bit of help with this. And they would kind of beat around the bush about it because it was something that wasn't talked about, right? So men don't actually understand just how common this is. 50% of men in their 50s, 60% of men in their 60s, it's common. It needs to be talked about because we can fix it. So they would start coming to me and we would talk about their issues, and I would get them on these treatment plans that would kind of address just whole person healing. And then they would come for their follow-up, and some of them would say, this completely fixed it, or I didn't even tell you this was a problem and it's gone away, so I'm very, very happy. And so I'm like, okay, there's something here. And I really did feel like we needed to start addressing these men specifically, targeting them specifically, because ED in and of itself sucks, of course, but it's actually a symptom that there's something else going on deeper, pending it wasn't a result of some sort of trauma. So the way they started breaking it down for guys was, well, you need 3 main ingredients to get an erection, right? We need adequate hormone levels, specifically testosterone. We need adequate blood flow, and we need adequate nerve conduction. When one or more of those things is not functioning the way that it should be, we end up with some degree of erectile dysfunction. But again, one of those happening means there's something else happening underneath. And 9 times out of 10, we can actually address a lot of these through just simple diet and lifestyle changes to actually heal the stuff that's happening. So that's kind of the targeted approach that we're taking with this company is, and the program that I'm launching for that will actually be launching this quarter. But it's basically taking guys through 12 weeks of all the things that they need to do to actually correct all these imbalances and truly heal the ED, truly heal yourself, your health, all of it.
So the nutritional changes, I'm sure it's focused on carnivore because there's a lot of diabetes and pre-diabetes and metabolic syndrome that the guys get the ED, the women get the PCOS or the menstrual irregularities.
Absolutely. You nailed it. It's so funny. One of the things that we have written on our website, it's, you're going to be coming to us and we're not going to make you eat vegetables. Yes, we're serious. I think it's just this really great shift too, because most of the time when I'm talking to people and talking to men, of course, and I tell them, yeah, you don't have to eat vegetables anymore, they light up. And it's like, okay, great. We're going to start off on the right foot here. And then, there's a built-in amount of trust with that too, is that, yes, we're going to meet you where you're at and we're going to give you this level of diet change. And it's going to make meaningful changes because, like you said, it's going to naturally balance their blood sugar issues. It's going to naturally give them all the nutrients that they need to actually, repair those blood vessels, to increase their testosterone by giving them the good amounts of cholesterol. And it really just works so synergistically with all the other things that go into it too, such as, we even talk about doing things like circadian light exposure so that we're recorrecting how you're sleeping and how your body's healing in that regard.
Can you talk a little bit about alcohol and what your thoughts are, certainly for men's erectile dysfunction, but just for general health and wellness for everyone?
So alcohol, so funny. My husband and I were on our live the other day. He made such a perfect comment. And it's that you will only ever get hangovers from plants. You're never going to get hangovers from anything animal based, right? It's only plants that will give you hangovers. And so alcohol is only ever a poison. It really is. I mean, you can cite studies, you can make arguments for it, but the truth is that it's a poison. And that means it's going to be doing damage to your body. And even small amounts, what people consider, 1 or 2 drinks a day, is absolutely going to be targeted. It's going to be causing damage to the liver. It's going to be causing damage to your blood vessels. It's going to be causing damage to your brain. And one of the ways to actually best correct that is getting on a carnivore diet, especially all the high fat carnivore diets. That's going to help repair. It's going to definitely help repair the brain for sure. It's going to give the liver nutrients that it needs. And of course, when you're removing all of that, your body now can actually get into a state where it's able to heal. What people don't know is that it's actually not the alcohol that gives you the buzz. It's the metabolites as your body tries to process the poison that cause the
Hmm.
buzz.
That's interesting. And the American Journal of OBGYN recently put a expert opinion out on healthy diets for pregnant and breastfeeding women. The top diet was Mediterranean, and they recommended red wine also. And the diets to stay away from included Atkins, paleo, keto, and they didn't even touch carnivore because it wasn't mentioned. But I think that we have to recognize that we're Western medicine and standard medicine. Even if you're a naturopath or a DO, or even if you're, I think, a TCM, traditional Chinese medicine, where it's mostly plant based, we're missing the point that there are tremendous number of poisons that come from plants, but really nothing that comes from animal based that I can think of.
Exactly. Right. It really isn't. And it's so funny because when you look at those recommendations and you wonder, do they actually believe in those recommendations, or are those recommendations coming from these medical people who are sponsored by our drug companies and the pharmaceutical industry? Are they making these recommendations because maybe they nefariously know how damaging they are, and it's just a really great way to continue to get customers or patients?
I think we're just, it's cognizant dissonance.
Yeah.
We so believe that it's your DNA, it's your genes, or it's the poisons that are planted in there in the water by industry. It's so we're the difficulty is to believe that the healthiest thing that we make statements in all of our cultures are a plant-based diet.
Yeah.
Wouldn't you say? And
I know. And it baffles me at this point because there is so much data that goes against that. It contradicts that. So now again, are we purposely when I say we, I mean as a society, are we purposely choosing to cherry pick this now just because we don't want to upset that narrative and we don't want to try to tell people that maybe we were wrong? Or I don't know, what is our next step? Like I know you and I are out here, there's other doctors that are out here, and we're trying to lead this movement by giving people this information and by inviting them to try it on themselves. And, you have people like Dr. Sean Baker, who's accumulated just a massive database of people who have healed eating this way. And I can truthfully say that I never did see this even when I was recommending vegetables to my patients. I never saw the healing that I see doing carnivore.
The healing was maybe a little more sporadic, but it was never nutritional. We never say, wow, that diet really worked. But now this is the one, don't call it a diet. I say it's not a diet, it's the way. And basically we've never seen this before. All the diseases like trickle away. They're just go away. And it's but our words to sustain us, and again, whether it's the food industry, the marketers, the pharmaceuticals, the doctors, I mean, we're all responsible. And I don't think we're here to blame anyone. I think what we're doing is working to share a story, because all I say is, listen, before you complain, you're right, this seems so ridiculous, you'd never do it and you never put your mother or father on it, but what do you got to lose, right? How many drugs, right? And you have one thing to lose. You're going to lose your doctor and you're going to lose your drugs.
Yeah, it's really that powerful. I have to agree. I always invite people, just give it 30 days and then maybe give it 90 days. And if you don't feel the changes, you can always go back to plants. Like you're always going to have the ability to go back to plants, but you might like it over here. Like you might like it on this side because you're going to notice that your skin gets clearer, your cognition gets better, your energy improves, you're sleeping better, you feel better in your body, nothing aches. Like it is just such a significant change. And I think it's so worth it. Like, and I personally, people ask, well, will you ever eat plants again? I don't see a need to. The longer that I've been in this, the more carnivorous I have become. And that's an interesting, I think, thing to say. Because before, I might have had like some berries, and now I'm like, I could take it if I wanted to, but I don't want it. Like, I just don't. I'm really set in my carnivorous ways at this point.
But if someone chooses to have some berries or Kiltz's ice cream with a little
Yeah.
sugar in it, or some fries, or a fruit or honey from time to time. What's your thoughts on that? If they're capable of like being strong on the carnivore side.
So the human body is incredible. And we have so many ways to detox things that shouldn't be in our bodies, right? We can remove them from our sweat. We can remove them through our breath. We can remove them through, of course, defecation, urination, even menses will help get rid of toxins, right? Our bodies are so good at doing that. So a person who's been on carnivore for a while, healthy body, healthy lifestyle, everything is functioning as it should be. If you want to go and have a little bit of like fries with a grass-fed bunless burger, I mean, your body's probably going to be able to handle it. If you want a little bit of honey in your Kiltz's ice cream, I'm sure you're going to be able to be okay. I think that a lot of people come to this diet because they have to be strict because they have a lot of things to heal. And it's great because it works. But once you've achieved that healing, if you are with a group of people, or you're on vacation, or something is just calling to you, go for it. You might get some feedback from your body that it didn't like it, but you're going to probably be able to handle it. And again, I don't think it needs to be this like dogmatic thing. That's my take on it.
And I think that's the important part here, that there's you choose where you're going to be. And if you're a vegan, vegetarian, or Mediterranean, or carnivorian, the support is there. And you have many treatments that help many of those people wherever they're at. And the dietary nutritional changes aren't mandatory.
No, they're really not. And the way that I teach it in the module is, here are the things that we definitely want you to cut out because they are not in line with our goals working together. Because again, if they're coming to me, they're in a situation where they need help. And this is the option that they're selecting. So we talk about, yes, we are making these changes because they are in line with our goals. And the ones that I make that are in the program are, I would say, more animal based than strict carnivore. But then once we actually get on the phone and we see, has this been working for you? Can we go a little bit stricter, or do we need to be a little bit more lax? And we make, again, more targeted recommendations as we get to that point. But again, most of the time, just the small changes towards animal based compared to where somebody was starting is usually enough to make a meaningful change.
Do you do all physical appointments? Are you doing more telemedicine appointments and those follow-ups? How frequently? And tell us how important those individual meetings are, and do you do group meetings, and how important are those?
Yeah, good question. So right now, the way that I have things structured, I have patients that actually come to me for stem cell procedures from all over. I've had people come visit internationally from Germany, the UK, Israel. I get patients from Canada, from all over the US. And we start initially virtual. So we can do phone consultations to discuss your medical history. The whole program is delivered all online. So that can be accessed from anywhere with an internet connection. But then actually coming in for the procedure and spending usually a couple of days with me, that's all done in person. Follow-ups we actually can do over the phone. We have a whole back end to actually the program modules that walks you through everything you should know about your healing cycle, when and how to start back with exercise. I even have a couple other like exclusive interviews in there with other providers that are really, really useful. And then of course I even go into like my healthy hacks, like all the cool things that I learned in naturopathic school, that you guys can also take home with you as well too. So that is all done again online. I do consultations for people via the phone pretty much all over. I do have to say, though, that I'm only licensed as a doctor in the state of Arizona, but I can act as a natural health consultant for other people in other places. And with that, I actually do have an online shop where people can order lab testing. And I don't know if you've seen that, but I actually created some carnivore panels in there that have been really, really useful. And I've been seeing some really interesting patterns. I actually just posted about them on my Instagram yesterday. And it was just kind of like my main takeaways that I've seen in patterns across people eating this diet, which has been, again, super, super useful.
And tell us a little bit about those patterns, what you're noticing on the carnivore versus the standardvore.
Yes. So in the carnivore community, I'm sure you're familiar with this. There's the term of what we call the lean mass hyper responders. And it's the people that get this massive elevation in their total cholesterol and their LDL cholesterol and their HDL, but their triglycerides end up staying super, super low. And they're otherwise very healthy, right? They're usually very lean, very fit, and generally feel pretty good. The pattern that I've noticed on those patients is that almost all of them have signs or a confirmed diagnosis of the MTHFR genetic defect. So that's been a really interesting correlation to make. And I'm not quite even sure what to make of it at this point, because I haven't really dove into it. It's just kind of a pattern that I picked up on. And I don't know if anybody else has really noticed that. So I'm also wondering too, if then, most people with the MTHFR defect have to have some degree of methylated B vitamins supplemented at their diet on an almost daily basis, because most of the time their diet just simply doesn't have enough of it for their needs. And the reason that I made that connection was because in one of the panels that I'm running, and it's like an expanded carnivore cardiac panel. So we also look at homocysteine levels and folate levels. And the homocysteine is almost always super, super high, and their folate levels really, really low, which is almost hallmark of MTHFR without actually running that test. So usually my follow-up to that is, have you been tested for this? You might want to look into testing for this. And again, sometimes it just requires more B vitamins than they might be getting in their diet at that time.
Is that the B vitamins found in your initial supplements that you provide and recommendations for those clients?
So if I'm going to make recommendations, I usually do recommend some B vitamins as a supplement. Obviously, I love if people can get their stuff from their food, but most of the time, we've been running these panels on people who have been carnivore, lion-based, carnivore keto-based for a good period of time, and they still end up deficient. So that being said, we still usually do have to supplement, and it's always going to be the methylated versions of those B vitamins.
So in the carnivores, what are your general recommendations for routine laboratory testing or other testing? Do you have something you're generally recommending, especially maybe looking for cardiovascular disease?
Yeah, so I have a couple panels that I actually custom made on my shop, but one of the things, because with carnivore, people get very concerned that the elevated cholesterol definitely means that there's cardiac damage going on. And there's a couple clinical pictures here that have been just really interesting for me to see. And I've actually even had patients of mine where they came to me not on carnivore, and we've switched them to it and have still been able to follow their blood work and been able to see some of these pattern changes. But sometimes we get patients and they have this cholesterol fear, or maybe they made their way to carnivore after being on statins for a while and 5-10 years, and then they made their way to carnivore, stopped those statins, and then they're freaked out by this elevation in the cholesterol that they're seeing. But to parse out whether or not there's actually damage going on underneath, we'll run a bunch of different things. One of them being oxidative LDL. So we're checking to see if the LDL that you have that's elevated is existing in its oxidative form. If it's not existing in an oxidative form, we actually don't usually have to worry about the LDL elevation in and of itself, because it's not causing any oxidative damage. We'll also run a small density LDL to see if there actually is any of those smaller density proteins there. And if there really isn't, again, probably not too much to be concerned about. We'll run something called a PLA2 enzyme. This is a marker of, is there some sort of cardiac repair happening? It's an enzyme indicated in that. So could there have been some cardiac damage that had happened previously that your body is repairing now? We see that one. That's an elevation. Again, not necessarily a concern, but just something to pay attention to. Because the other aspect to this is, yes, we'll get your initial labs and we'll see this as a snapshot in time. But if we retest in 3 or 6 months, now we actually see a trend. So we see, did things go up? Did things go down? Is what you're doing actually working to move things in a meaningful way? Another thing that I usually like to check is something called the myeloperoxidase, or the MPO enzyme. And this is actually another indicator of, is there any sort of cardiac damage possibly occurring? And should something like that actually show up, sometimes I'll say, well, maybe we should look at a coronary artery calcium score to see, is there actual calcifications happening? Because then we can also be very targeted with our treatment plan if there is calcifications that we need to work on. So the other, I guess, part of this story too is that just because somebody did end up at that point at some degree in their carnivore journey doesn't mean that carnivore is what did it. This stuff could have been from before in your previous life, and that actually making your way into carnivore is what triggered the healing and repairing that might be going on, that we're seeing reflected as the high LDL or the high PLA2. And so this is why it's also important to do a follow-up to see if we are trending in the right direction.
So on the nutritional side, do you focus on on what levels of lean versus fatty meat? What ratio do you individualize it? Do you have sort of a generalization? What are your general practices and recommendations?
Depends on the goal that I'm working on with patients. For a lot of the time for women, we simply just have to get them eating way more protein than what they've been used to eating in their lives. And we'll kind of add fat as needed to keep energy levels and satiation levels high. I do find that women are more prone to carb cravings than men. For whatever reason in this, it's just what I've seen clinically, is that they will, if you're not giving them enough fat, they're going to be the ones that are going to like, okay, I've got these cravings and I might break things, just to go for that. For men, sometimes what I see in guys is they actually have a more difficult time holding on to weight when they start doing carnivore. It's really easy for guys to like lean up a lot, and sometimes they don't want to lose that much weight that quickly. For them, we usually have to start pretty high fat to really keep that on, while also keeping their protein levels really, really high. I don't know if you're familiar with Dr. Gabrielle Lyon. Her whole thing is called what she calls muscle-centric medicine. And she's very much on the same page as far as, are we getting enough protein into people to actually do all the healing and repairing that we need? Because our needs every day are roughly about a gram of protein per pound of body weight. And most people in the carnivore community kind of get that and they understand that. And people are eating anywhere from 1 pound to 2 pounds of meat in a day, which is usually really sufficient. But again, to balance the other needs, which is hormone production, joint healing and repair, energy levels, keeping lean mass on the body, sometimes you really have to play with the fat ratio.
So do you generally recommend a higher fat, the 80, 50? Where do you sort of, like, as a generalization, would you throw it out there if you're just talking to the community and not talking to that individual patient? Do you have any sort of thoughts on that?
Oh man, it's such a, I feel like it's such a almost not loaded question, but it's
Well,
so hard to make a blanket recommendation, because I really do believe that everybody is kind of starting where they're starting. I know personally, when I jumped into doing carnivore, I needed way more fat than I do right now, because I think I had a lot more healing and repairing to doing. So if you're starting out, I would say starting out high fat is going to probably be the safest recommendation than starting out with just the higher protein. There's just so much that the body needs to repair, and you're not going to go wrong with high fat. You're going to really cut the cravings with that. You're going to make sure that you're feeling very satiated with that. Do I think it needs to be as high as 80% and, diving into ketosis initially? For some people, probably. But I think that you could even just do 60-40, you could even do 50-50, and again, play with it, because your needs are probably going to change and shift as you go deeper into it.
yeah, and I think each individual is going to feel good or bad depending on that ratio,
Yeah.
and it's going to be easier or harder depending on that ratio. So, and there's so much healing of the gut that needs to happen first. And I agree with you. Higher fat's better initially. You can you can drop down over time, especially if you want to lean up a little bit more,
Right.
because fat provides a lot more calories, twice the calories than a protein or a carbohydrate. And that, I think, is really important. What's been your biggest challenge in the carnivore space and for yourself personally, and Zach's too, because I know Zach's also carnivore. And
Yeah. So, gosh, biggest challenge. I don't even get a lot of pushback on social media, which I think is really cool. I thought that was going to be the biggest thing, is just listening to people and their sort of, I want to call them limiting beliefs about what is possible for their diet and their strategies. But thankfully, that actually hasn't been a problem. I think the biggest thing for us has just been, how do we structure social lives, right? Because we don't really go out to dinner a lot, and a lot of social activities are structured around eating. And this is kind of silly, but we've just noticed that our interaction with our friend groups has dropped down, because I think that people don't want us around with our weird eating habits. And I don't even know if that's even the case, right? But it's just something that we're wondering, because our social situation has just, we're boring. We don't really do a ton of stuff. We don't really go out a lot. And again, it's so much of that is centered around food that we just don't eat.
And isn't it likely that boring is the best way to the best health in a baby? That's why I say boring is the best way to a baby, because
I love
ultimately,
that.
when you're not boring, what are you doing? You're going out, you're partying, you're drinking, you may be smoking, you're doing other things that maybe aren't the best for your health and wellness. You're not going to bed early. You're not focused on the things that make you the very best in order to make your family the very best. And is your focus mostly on men or mostly on women in your practice, by the way?
I see both, but our company, Harder, Happier, Healthier, is men's focused. But I do see both in my practice because I do both against sexual health and chronic pain issues. And I have to comment on your boredom thing because we literally do go to bed usually between like 8 and 8:30, at the very latest. And I will tell you, like Oyster Boom was kind of bred out of boredom because I'm sitting here just reflecting on how can I get oysters into people, like, and it's that boring food choice, that healthy targeted food choice that I'm making, that I'm thinking, how can I bring this to other people in a meaningful way? So I think there is a good place for boredom in your life and giving yourself just the space to be bored so you can come up with these ideas and you can do things that are good for you.
Other things outside of the nutritional side or the straight medical side, what other things have you incorporated into your healing practices?
Two main things that I really love, getting sunlight and sauna.
Mm.
We have a sauna and it's actually a red light sauna too. So we get the double benefits of it. But inducing those heat shock proteins is actually an amazing way for getting your hormetic stress in. So it's a good stress on the body. So it keeps everything running very, very well. But it also induces a lot of anti-aging genes too. So we love our sauna for that regard. And then just getting sunlight. So the sun has been demonized for so many years, and we've been told to slather on sunscreen and really protect ourselves from it. But every single one of our cells on our body actually has photoreceptors for the whole spectrum of UV light, and it actually does do good things for us. So your mitochondria will actually only make vitamin D in your skin in the presence of two things. You have to have adequate cholesterol levels in your body, and you have to have the light exposure happening, all of the full spectrum. And that's where you get the vitamin D. People are always very shocked coming to see me, my Arizona patients, because they're like, oh, I live in Arizona. Why am I vitamin D deficient? I'm like, well, could be the cholesterol lowering medication that you're on. Could be the fact that you're covering up most of your body when you're outside. And maybe you're not outside even at peak times. But I think that we actually need to change the conversation on sun exposure to, instead of just being avoid the sun, to how can we use the sun therapeutically in a meaningful way to actually amplify our health?
Get outside, get into nature.
Yes.
It is critical that we need to get outside. And
Yes.
we get up, we go to work, we're in our house, our garage, our car, our office, or wherever you're going, you're running around, but we're not. It's fall, beautiful here in upstate New York. It's just, I've been outside a little bit already today, and I'm going to get out a little bit more. And just if you're sitting and doing some grounding work with the barefoot in the grass, or
Yes.
that's all you need.
I know. And it's so grounding is such an interesting topic. That was actually one of the first things that we learned in naturopathic medical school, grounding. And it was, the research that's actually behind it, you can find piles of research, legitimate on PubMed, that supports grounding for reduction of inflammation, reduction of pain. It's got a whole host of things. And it's the simplest thing you can do. You literally just have to walk outside barefoot for a few minutes. It's the simplest thing. We need
So
to be doing more of it.
you mentioned hormesis, and I actually looked
Mm.
up hormesis today because small amounts of stress or some stress actually improves your body in some way. But there's a lot of talk about plants and hormesis, which I have just a little different take on it personally. But I wanted to get it's sort of a poison. A small amount of poison over time somehow makes you better. I can understand when it comes to like exercise and stretching and things like that. But what's your thoughts on hormesis when it comes to plants and poisons and things like that?
I feel like the person who started that trend had just watched The Princess Bride a little too many times, right? The guy who drinks the poison a little bit every day so that when he actually gets to the point where he needs to use it against somebody else, he doesn't die. I think maybe that's where they got that from. But, you have to extrapolate that then too. Are all plants and their poisons a hormetic stressor, right? Like, is your cocaine habit a hormetic stressor, or are you just stretching it? Is your alcohol addiction a hormetic stressor, or are you stretching that too, right? Are the oxalates a hormetic stressor, or do you just really love your spinach salad? I think that, yes, that maybe those things are kind of silly to compare, but are they? It's still a poison entering your body. I don't think that poison is necessarily a hormetic stressor. Of course, like you said, the same way that exercise is, or that even cold exposure is, or that a sauna is. Those are legitimate because you're going to get that positive feedback in your system without the initial poison. It's the stress minus the poison.
Right, right. I think that's critical. And I think, so maybe a conversation a little about coffee and tea and other plant-based drinks. Where you have your opinions there?
I am still drinking about 8 ounces of coffee. I tried giving up coffee and it was just not good for those around me. And I will probably get back there. It has gotten to the point. I used to be about a 20-ounce coffee drinker every single day. It's gotten to about 8 ounces. I'm measuring it, and even then, some days I don't even finish the whole cup. So we're slowly getting there. Yes, coffee is definitely a poison. It is definitely a toxic bean juice. And it's the other thing with coffee too, is that it does chronically deplete minerals. So this is, again, another I am so on my mineral, like my little podium about minerals, because I do feel like most of the population is definitely mineral deficient to some degree. Especially, again, we're eating plants, we're drinking coffee. So yes, it is definitely toxic bean juice. When it comes to tea, I do think that tea could potentially even be a little bit more toxic, because a lot of time it's just the dried fresh leaves. So sometimes coffee, it's roasted, there's some cooking, there is some removal of some anti-nutrients to a degree, but with leaves, you're basically, again, just getting a toxic leaf juice right away. And I think about back to when I used to drink a cup of green tea once or twice a day. And I'm just like, what was I doing?
And mold and the mold toxins. And that's what I'm concerned about. I think, it sounds that we've sort of heard it somehow it's herbal tea is better for you. And, but in general, a cup of tea, a cup of coffee a day, not this big a coffee cup, but a Kilt's cup size is likely less toxic, but I've been off it now for almost 4 months, coffee. Amazing. And which is radical. And because I'm got a coffee pot everywhere. I would bring a coffee pot wherever I went, my espresso maker, because it's like no one else makes this coffee that I love. And but it's amazing.
I'm with you. We'll call it bougie about coffee, because we used to bring like our pour over whenever we would go to a hotel room. And, we would make it a point to make sure that we were buying like really high quality coffee, certified mold free, organic, like the whole thing. So at least, again, it is quality. It really does become a bigger problem when you're the Starbucks coffee drinker every day, or any of those other coffee places, because they are, like you said, just riddled with mold. And I used to do that. I used to drink coffee every day when I was in college, and I would go to Starbucks and I would study. And it wasn't until I went to go see a naturopathic doctor, because I was having headaches every single day, and they were like, "Oh yeah, it's the mold in the Starbucks coffee that's causing it." I'm like, darn it,
And if you're adding the syrups and the milk and things like that, you're adding a lot of calories that likely your body doesn't need, and you're not eating full cream or butter in them. Maybe that's a little bit better in the journey. Iodine. I wanted to ask you about iodine. What's your thoughts on iodine deficiency? Do we have enough of it? Are we getting it from an animal-based diet? Do we need to take a supplement?
I would say that most people are not getting enough iodine in their diet. And this is just evidenced by rampant hypothyroid throughout the population. And again, I say that because I have my doctor bias, and almost everybody that walks into my office has some degree of low functioning thyroid. And what's happening in the traditional medical model is that you go to your doctor and ask for your thyroid tested, and they will only run your TSH, which is your thyroid stimulating hormone. Well, TSH actually is it's not the marker for how well your thyroid is functioning. It's actually the signaling that goes to your thyroid, tells your thyroid to release thyroid hormone. Well, when the thyroid releases thyroid hormone, the first version that it gets released as is your T4. T4 is the inactive version of thyroid hormone. The body requires zinc, selenium, and iodine in order to convert the T4 into the active version, which is your T3. So T3 hormone is the one that's doing all of the main work in the body. It's the one that's actually preventing all of the low thyroid symptoms. So what are low thyroid symptoms? Well, we have constipation, we have dry skin, we have breaking nails, we have thinning eyebrows, any sort of other hair loss. And then of course, the thing that most people see is actually the weight gain and the brain fog and just the fatigue. So if we take those clinical symptoms and we see a quote unquote normal TSH, that's not the full picture, right? We know that there's something else happening. So when we take a look at that, and if we see a normal TSH, a normal T4, but a suboptimal T3 with clinical symptoms, we know that it's actually a mineral deficiency because we're not getting the conversion of the T4 to the T3. So this is where we might have to consider something like the iodine, for example, in addition to the zinc and the selenium. Now, iodine, we know is most commonly found in actually seafood. So could a carnivore diet be sufficient in iodine? Absolutely, if you are getting some seafood into the mix. So scallops, oysters, even other certain fish types are going to be really great for that too.
Sardines, anchovies, cod,
Yes.
those sort of things. So your oyster supplements would provide that.
They do.
And Lugol's iodine, do you have any recommendations on that? Do you?
I don't use it. I honestly, my whole preference on where people should get their nutrients should be as animal-based as possible. Like if we can actually just eat in a way that is more in line. I'm not sure if you're familiar with Weston Price and his work about the ancestral diets and everything like that. I think that the more closely that we can get to getting, again, most of our, or if not all of our nutrition in the way that we are meant to is going to be better for us. I think that if we're going to use supplements, especially a non-food-based supplement or a non-animal-based supplement, that it should be short-term, strategic, and simply done to compress time. Because again, if we want to do animal replacement, sometimes it just takes longer because we have to eat more because we're not getting the higher dosage that you can actually concentrate in supplements.
Mm-hmm. And so what's the real problem with the plant-based diet? What do plants do to us in just a simple sort of, because these are so critical and important things. We get all our minerals and vitamins from plants, and they have a lot of great phytochemicals that are good for us. But what's your thoughts on what's the real trouble?
The biggest thing, well, besides the fact that they're just giving us poisons when we eat them in the form of anti-nutrients, they're also blunting our absorption of the good things with their anti-nutrients. So oxalates, lectins, phytates, those will all blunt mineral absorption. But the other way that they're blocking absorption is by destroying our gut. So we can't absorb fiber. Most of the time there's gut dysfunction happening in people who are chronic plant eaters. So it's not only you are what you eat, it's you are what you absorb. And if you're eating some of the right things, but they're combined with plants, you're not going to get the absorption that you think you are. And you actually are going to end up some degree of nutrient deficiency just by doing that.
So fiber, comments on fiber and constipation?
I have never had such great bowel habits since I stopped eating fiber. And this has been the thing across the board. We don't need it. Humans don't require it. And in fact, there is a big argument for the fact that it is doing more harm than good for us, because again, it is going to be blocking the absorption of the things that your body actually wants to eat. And what's so fascinating is that a lot of people in the carnivore community find is that you actually have less bowel movements, but you're not constipated simply because your body is so efficient at utilizing everything that you eat.
Well, the word constipation, it's another marketing term that was creating a disorder that really didn't exist when we didn't eat plants. And when we started eating plants, we got all the pain, the bleeding, the bloating, all of the symptoms that then we developed the drugs. And is it necessary to have a bowel movement every single day?
No, if if you are eating a animal-based carnivore diet and you're not experiencing any other digestive issues, you can probably go a day or two without having a bowel movement. But if the opposite is happening, where you actually do have symptoms and the bowel movements that you are having are less than favorable looking, you might want to see somebody, get that checked out.
Blood in your stools, and
Blood in your
certainly
stools, undigested food in the stools is a big one, mucus in the stools, any stool color that varies from like a medium brown, so green, yellow, pale, red streaks. I mean, people think I'm just listing the rainbow when I start talking about their poop, but like those are other variations that we have to consider. And it does tell us a lot about what's going on internally and about your health overall.
the fiber ferments, and fermentation makes beer and alcohol.
Yeah.
And it's circulating throughout our body, and it's a major toxin. What water. Dr. Solt, what's your thoughts on water? And I'll throw in salt also there.
Yeah. So of course we're made of water. We're 70% water. We need to be drinking water. Now, how much do we need to be drinking? This is the like $1 million question, right? So you'll get some people recommending, you need about an ounce of water per pound of body weight. For some people, that's an enormous amount. And I'm guilty. I used to actually recommend that to people. But again, the more that I've dove into, what does it actually mean to be hydrated? What does it actually mean to have enough water to just run our body? I think we need to be listening, one, to our thirst cues and drinking when we're thirsty, but also being so mindful of electrolyte and mineral status, because that's actually the indicator of whether or not you're hydrated, not just how much water you drink. And the source does matter. If you're drinking reverse osmosis water or distilled water, that's what's known as, we'll call that an empty vector. So it's actually going to pull more minerals out of your body in order to, because it wants to hold on to something. So you're going to actually become more dehydrated drinking that type of water. And it's again, making things worse. So drink water when you're thirsty, get adequate levels of minerals. If you have to add something like Redmond's real salt or something to your water to get that mineral status in there, go for it. But I think that's definitely where I stand on it, is minerals first indicate hydration levels.
And use of salt, Redmond's you like?
I do.
And salting our meat is good and okay to do. We shouldn't have to worry about it.
Salt's not the problem. I think salt has been improperly demonized and was kind of like the scapegoat for the damage that sugar did. So people will say, oh, don't have too much salt. It's going to damage your kidneys. No, it's the sugar that's actually damaging the kidneys. This is why diabetics end up on dialysis, not because they're eating too much salt.
So whatever reasons our modern medical establishments haven't come over to the carnivore side, I call it the 5%ers. Yeah. Ultimately, lions are 5%, and they're the leaders. Yeah. The rest of us are in the pigs, cows, and sheep. But everyone could come to the lion side, and yes. It's simple. It's simple. Any pearls of wisdom that I haven't brought to light, that would love you to hear what's important to you?
Oh gosh, I think the biggest thing that's important to me is just giving it a try. I just want people to try it. Like, just experiment with it. Come into this with an open mind, because that's going to ultimately be the thing that tells you whether or not this is true or not. You see people arguing online all the time about the merits of this diet, the merits of that diet. And you can truthfully find a study to support literally anything. So to say that, this is the best diet based on this study, that doesn't say exactly how it's going to work in your body for your needs. The only way to simply know is just to try. And until you've actually tried it in a meaningful way, I don't think that there is room to argue that it is ineffective. So that's what I want people to take home from this, is just give it a try.
And what's on the 23 agenda for you and Zach, and your creations? And
yeah, so like I said, we're going to be launching that men's health program to actually help men heal and recover fully from ED this quarter. So definitely by the end of the year. It's just, it's something that I'm really pouring my heart and soul into, because it matters to me to just give people as much information as I can pack into a program like this. So it keeps going through iterations. It's like a living document right now where I'm like, dump this in. So it will get released. I'm one of those people that I want like some degree of perfection before it's out in the world. we obviously have our supplement that we're really hoping that, that it just goes wild for people and that people love the results and that they're just going to continue to keep taking it. And that's going to, we're super excited for that. We might consider adding a few more aligned products to our database. Right now, this is our only one that we were really solid about getting our name behind. But we might consider, a few other things too, if we can find something like a collagen that might align with us or something like that. So that's it for right now. Yeah.
Eat meat.
Yes.
Be boring.
Yes.
But boring isn't taking away. It's actually adding something that allows you to focus on being the best you can be.
The white space in your life is the space for creation.
That's and again, the word boring, again, we're a temple. Yeah. We're a very important temple, and we need to focus and take care of that first. So Sabrina, Dr. Solt, God bless you. Thank you so much for being with us today. Much appreciated. I look forward to listening and learning from you and Zach and more health and wellness tips around the globe.
Yes, my absolute pleasure. Thank you again so much for having me. And I hope this was valuable for your audience.
Well, I'm sure it will be, and they'll keep watching you. Again, where can they find you?
I'm mainly on Instagram. My handle there is just at Dr. Solt, DrSolt. My main clinic website is stemcelltherapypro.com, and Oyster Boom can be found at harderhappierhealthier.com, and we'll send you a bottle, Dr. Kiltz, so you can give it a try.
Would you please? We'd love that.
We'll put some
links to that. So thank you. God bless. Again, you guys take care. All right. Bye-bye.
Bye.
Bye, Sabrina. Take care.
Yeah.
I'm really excited and honored to welcome back Dr. Sabrina Solt. Dr. Solt is a naturopathic medical doctor by training who runs a private practice in Scottsdale, Arizona that is focused on regenerative and anti-aging medicine. She performs stem cell therapies, whole body support to her clients that deal with chronic pain, sexual and erectile dysfunction. She incorporates the use of keto, yet mostly carnivore, and has been monumental for Solt's practice and success. And so, again, so many great improvements and outcomes. We want to welcome Dr. Solt. Thank you for being here today. Malcolm, have a good one. Thank you so much. A great interview with Dr. Solt, and I'm looking forward to more exciting stuff to come. Thank you, everyone. Thank you again for joining us. Check out Carnivore Conversations with Dr. Kiltz, and don't forget a like and a subscription on our website. And don't forget to check us out on YouTube, and a thumbs up and a subscribe would be very appreciative. Thanks for joining us on Carnivore Conversations. My name is Dr. Rob Kiltz, and we really appreciate you listening, watching, sharing, and hope you're learning for your very best healthy life.